Welcome, everyone. This is Furniture as a Therapeutic Intervention. It is fun to kick off this series where we will begin exploring how design influences behavioral health environments. Behavioral health spaces are not neutral. Lighting, sound, layout, and furniture communicate signals to the nervous system about safety, control, and dignity. In this series, we'll explore how thoughtful design can support trust, recovery, and therapeutic engagement. I am Dr. Melissa Steach. I'm the Regional Engagement Manager at Pineapple, and I'm so happy you're here with us today. So let's begin with an informal poll. And full disclosure, I can't see the chat, but I do have Lucy who is helping out and she can. So just know that your chats are being reviewed and looked at, and I will address them when I can, if not during this session, but after. So back to this poll, shall we? What do you think drives most incidents in behavioral health settings? One, is it settings? Two, is it the policies? Three, is it the physical environment? Or four, all of the above? And again, share your answers in the chat. Lucy will be in there to see what we come up with. If it's what I suspect it is, most audiences select all of the above. And they're right. Behavioral health care operates as a system where people, policies, and environments interact. Historically, we've focused on staffing and procedures, but the environment also plays a powerful role in shaping behavior and outcomes. Within seconds of entering a behavioral health space, people begin interpreting environmental signals, lighting, acoustics, spatial layout, and furniture, all because they communicate whether a space feels safe or threatening. These signals influence emotional regulation, willingness to engage in care, and interactions between staff and patients. And what I'd like to add here that sometimes gets overlooked is family. Those people, family and friends, and the ones who care about the people who are in these spaces to heal and the people who work in these spaces to provide healing. In many projects, furniture is treated simply as equipment. And when we think about what I just said there, how does that sit with you? Just something to be specified late in the process. I don't know about you, but when I walk into a space that feels unkempt or not considered, doesn't leave me with a good feeling, even if I'm just going through. So in behavioral health settings, furniture shapes movements. It supports and primes emotional regulation, excuse me, and social interaction. When we recognize furniture as part of the therapeutic environment, design decisions become much more intentional. And when the intention is to aid in the facilitation of trust, safety, and recovery, furniture becomes more than just well-designed product. It becomes an optimally designed tool for supporting people in applications in some of the most challenging care environments. So when you look through this, and you think about selecting furniture for behavioral health environments, it's imperative that you balance several important considerations. First, safety and risk reduction, addressing concerns like ligature risk. And if you don't know what that is, someone being able to harm themselves, tampering, climbing, picking. Something called pica is where, because I'm aware that some people on this call may not be so familiar with behavioral health terms, is when you pick apart or ingest materials that are not meant to be consumed and ingested. And then there's contraband concealment. Second, you want to think about strength and durability. These environments place unique demands on materials and construction. And then third is the therapeutic environment itself. Elements like materials, lighting, acoustics, and ergonomics influence how people experience a space and how well they're able to regulate stress. The goal is to balance all three in ways that ultimately support trust, safety, and recovery. By placing trust, safety, recovery at the center of our approach, we ensure that practical furniture and pleasing design becomes a silent yet powerful tool for healing. And these are designed to be short, quick highlights that you can take through the day. So I'm going to ask you to take a moment here to reflect about an environment you work in or a project you're currently navigating. And as you do this, consider which part of the framework feels least developed or most overloaded when you go into it. What might those feelings be telling you? And I'm going to go back here just because we have the time to show you these. Is it safety and risk when you look around in a place that either you're in or you go to? And again, for those of you who are on this call who are not working in behavioral health, this can be as simple as psychological safety in the workplace. Are there areas where you could apply some intentional design to increasing the sense and the utility of safety and reducing risk as an outcome? Is it strength and durability? Do you have what you need to handle the testing and the usage and the degree of abuse in some ways that your work day requires? Does what you have, is it up to the test? And then third, is the environment therapeutic in itself? And again, this goes beyond just behavioral health. This goes into different acuity settings, along the spectrum of need for care. Is there a place when you're having the worst day of your life that you can retreat to, that you can take respite in, wherever you are? And think about that as yourself, as someone who is in the workplace. Think of that for the people with whom you work, and think about that if you are in a healthcare system or environment for the people whom you're taking care of. And as I said, these are designed to be short, and together we've really only scratched the surface of how the environment influences behavioral health outcomes. So I invite you to mark your calendar to join our upcoming Insight sessions. And we are going to work together to discover and discuss how we can design better spaces that hold space for respite, for recovery, for healing. And if this topic is interesting to you, we're offering an accredited CEU entitled Designing for Trust and Recovery, Evidence-Based Design for Behavioral Health. And the CEU really takes a deep dive into the research and the statistics behind behavioral health environments and the design that supports it to explore practical strategies that architects, designers, and facility leaders can apply immediately. Can be small and mighty, the changes that we can make every day to the environments in which we work and live. I invite you also to contact your local representative to schedule a CEU if this is of interest to you. And they're all here listed on the screen throughout North America. And you can also register via the link in the chat that Lucy will put there or follow up with so that we can continue the conversation with you. I'm very proud to have kept this to 10 minutes. If there's anyone on here who knows me, you know I can talk. So thank you so much for your time and have a wonderful, wonderful day.